The SteriLift Drape is an essential safe patient handling mobility measure to support staff with safe patient handling equipment use by providing a contamination barrier while being utilized in contaminated areas. Many COVID-19 patients continually cough and sneeze, thus aerosolizing droplets within the room. The SteriLift Drape provides equipment protection from this type of virus and other aerosolized particles from depositing on and inside irregular and hard-to-clean surfaces such as attachments and lifting belts and straps that may be stored inside of the units. The use of the SteriLift Drape is critical during patient isolation, fall scenarios, repositioning, transfer, and mobility within the room of a contaminated patient. It is proven that maintaining mobility, skin integrity, and providing adequate care is essential for positive patient outcomes and decrease in hospital length of stay. Utilization of this drape allows staff to safely utilize safe patient handling equipment with 1 or 2 caregivers in a contaminated room and conserve critical PPE resources. Without this critical consumable protection, staff will be forced to manually manipulate the patient, significantly increasing the risk of patient and staff harm, which is in direct conflict with Safe Patient Handling and Mobility Program Directive 1611. Thank you.
Hello, my name is Kurk. I'm the inventor of the SteriLift Sterile and Non-Sterile Drape. This was done through LAD Medical under license from the Veterans Administration. This product is fully owned by the Veterans Administration in conjunction with LAD Medical licensing. Drape application, step 1. Position the arrow. You must open up the drape, unfold it, and position the arrow away from you. Following this, you must open to the center of the drape. Look for the reinforcement materials on the left and right side of the colored portions of the material. Step 2. Approach the lift and apply drape. What you have to do is make sure that you get the center portion of the drape around the hooks of the spreader bar and up and over the articulating arm of the lift, whatever lift you have. This was designed as a universal application, so this can fit on most lifts. Step 3. Pull the drape up and over the articulating arm, continue downward all the way down to the base of the lift itself, making sure the entire lift is covered. Step 4. Applying the sling. Secure the drape inside the spreader bar of the hook. How do you do this? You have to take your finger and guide that material down past the actual latch on the lift spreader bar arm and get it all the way down into the curve of that hook itself, making sure you can actually feel the bottom of that curve. Once that's complete and you can feel the bottom of the curve, then you can bring the loop of that sling up and over past the latch and down to the base of that hook. What you want to make sure of when you're doing that is that following placement of the sling loop, that you come back up and move the latch forward, making sure that's done on both sides. And the last part of that is you have to check for stability, meaning you have to press down on the bottom of that sling and make sure that it's seated at the bottom of the hook itself. You must look for the 2 3M plastic straps that are on the drape itself. These straps are designed to be detached. There's a sticky portion on the end of that strap. You wrap it around the drape and secure it to the drape itself, bunching it up and away so it doesn't get in the way of your clinical procedures. 2 sling application procedure. 2 straps on one side, 2 straps on the other, and make sure that you have that strap past the closure latch and down into the bend of the spreader bar hook, and that the latch portion is pushed back up on both sides to finalize the procedure. Then you press down on the sling, make sure it's seated and against the curve of the hook for security. You are then able to perform your lifting of limbs or whatever safe patient handling procedures your facility deems safe for that patient. Following a patient discharge, you are able to strip the drape in reverse fashion, meaning from the base of the lift back over the articulating arm and off of the spreader bar, and put into the dirty red bag trash and thrown away. Thank you for watching this presentation. If you have any questions, feel free to contact our company. We'd be glad to address those concerns. Thank you very much.